Well, there's big news out of Washington, D.C. this week as Medicare is proposing yet another pay cut for doctors. And if it goes through, it's going to make it harder for seniors on both Medicare Advantage and Original Medicare to see their doctors. So I'll break down now what's actually happening and why it matters for anyone on Medicare or about to be on Medicare. See, every year Medicare updates what's called the Physician Fee Schedule. It's the price list that goes with every doctor, surgery, and lab service that's paid for by traditional Medicare. So for 2026, CMS is proposing a pay cut of approximately 3 to 4% across the board for doctors. That might not sound huge, but for small clinics and specialists that are already struggling with rising costs and staff shortages, it's a significant blow. Specialists like cardiologists and orthopedic surgeons are expected to feel it the most because those are the doctors that are often handling the most complex, life-saving procedures. And many are warning that lower reimbursements could literally push them out of the Medicare system altogether. The American Medical Association, the AMA, and several specialist societies are already pushing back, saying that these cuts threat patient access, especially in rural communities. So here's where it connects to you. Even though this proposal focuses on traditional Medicare, Medicare Advantage plans are built on the same foundation. When CMS lowers the physician reimbursement rates, the private insurance companies now say they don't have to pay doctors as much either. So that can lead to fewer specialists agreeing to be in-network for Medicare Advantage, which is already struggling. In some areas, they could completely lose access to doctor groups altogether. If you're on Original Medicare with a Medicare supplement, and you think this doesn't affect you, your coverage won't change directly because Medigap pays what Medicare doesn't pay, but we have to make sure that the doctors want to stay into Original Medicare itself. So if more specialists stop taking Medicare, then Medigap members will be squeezed too, not through higher costs, but fewer choices of doctors. Congress needs to step in. They've done it many times before, usually at the last second to stop cuts like this from fully taking effect, but that needs to happen before 2026, and Congress is not getting much done right now. Every time, they'll go back and make a little Band-Aid fix and temporarily fix the problem, but keep it from getting worse, and Congress needs to do that now. They've done this at the last second every year since 2001. CMS's goal is, they say, to balance the payments that go to doctors and make sure that people have access to primary care still. But the longer that they wait, as we get to the end of the year, especially with the government shutdowns slowing everything down, patients are at risk of losing their providers for next year, and we hope that doesn't happen. So what can you do? At least stay informed, stay vocal, reach out to your member of Congress if you haven't done so already, and tell them that doctors need the pay to go up, not down. I'll continue to keep you informed on this and everything as it relates to Medicare, but make sure you're subscribed and share this channel with somebody that you care about that's on Medicare. I'm Chris Westfall. Thanks for watching.